Physical health and mental health are closely linked. Unfortunately, for patients with identified mental health disorders, many providers tend to attribute their symptoms to the psychiatric diagnosis. Medical conditions are then left unrecognized and untreated, and patients feel as though their concerns are not being fully considered. Performing additional screening in patients with depression and anxiety ensures that both mental and physical health needs are addressed. It's especially important to evaluate for these possible medical conditions when 1. The patient presents with new onset depression or anxiety with no prior history of such symptoms. 2. The patient has notable physical symptoms or complaints in addition to the mood symptoms. And 3. The patient is having little or no response to the interventions that are meant to target the depression or anxiety. In this Med Mastery lesson, we'll review the more common diagnoses that may cause or exacerbate depression and anxiety. And you'll learn how to use the symptom assessments along with the physical exam and laboratory data to screen for these medical conditions. Thyroid dysfunction, which can be tested for by checking thyroid stimulating hormone, or TSH, free thyroxine, or T4, and total triiodothyronine, or T3, can lead to mood symptoms. Hypothyroidism is associated with depressive symptoms, including low mood, fatigue, and decreased energy, poor concentration, and a tendency to sleep more. On the other hand, the hypermetabolic state that is seen with hyperthyroidism can cause anxiety symptoms. Low serum vitamin B12 levels are associated with depressive symptoms, including depressed mood, fatigue, and cognitive slowing. Elderly patients with low vitamin B12 levels can actually present as though they have dementia. Folate and vitamin B12 levels are typically checked together. The two vitamins are functionally connected, and high folic acid levels can actually mask low vitamin B12 levels. People following a vegetarian or vegan diet and older people are at a higher risk for low B12 levels. B12 only naturally occurs in animal products, and elderly people tend to have difficulty absorbing B12, even if their intake seems adequate. Autoimmune disorders such as lupus, multiple sclerosis, and rheumatoid arthritis are often associated with depression and anxiety. Testing for the anti-nuclear antibody, or ANA, is usually one of the first steps in screening for an autoimmune disorder. Diabetes mellitus and depression occur together at approximately twice the rate than would be expected based on chance alone. Various causes are thought to possibly explain this connection, including endocrine dysfunction, inflammation, and unhealthy sleep, diet, and exercise habits. Depressive symptoms can make it even more challenging for patients to manage their diabetes effectively. Monitoring fasting blood sugar and hemoglobin A1C is performed as an initial screen for diabetes. Hypoglycemia, or low blood sugar, occurring either as a standalone condition or the result of diabetic fluctuations in blood sugar control, is associated with a variety of physical symptoms, including dizziness, sweatiness, increased heart rate, and shakiness, all of which can be seen with panic attacks and other anxiety disorders. Similarly, hypoxemia, low levels of oxygen in the blood, which can result from respiratory diseases such as asthma or bronchitis, also presents with physical symptoms consistent with panic attacks and anxiety, such as shortness of breath and increased heart rate. Anemia, which can be diagnosed by testing a complete blood count looking specifically at the hemoglobin and hematocrit, can also lead to anxiety-related symptoms, including dizziness, weakness, shortness of breath, and irregular heartbeats. It is estimated that 10 to 40% of patients with panic disorder also have mitral valve prolapse, which is diagnosed with an echocardiogram. These two conditions can also have overlapping physical symptoms, including heart palpitations, chest pain, and shortness of breath. Symptoms of depression and obstructive sleep apnea also overlap, including restlessness, sleep disturbance, fatigue and poor energy, and poor concentration. And patients with obstructive sleep apnea have been found to have a higher prevalence of depression compared to the general population. The Epworth Sleepiness Scale and the Stop Baying questionnaire can be used to screen patients suspected of having sleep apnea, but a sleep study is needed for a definitive diagnosis.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Med Mastery can help you become a great clinician, make sure to watch the About Med Mastery video. So thanks for watching, and I hope to see you again soon.